Para nosotros un gusto. Muchas gracias, Ramón. Muchas gracias, Xavi, poder participar en esta serie de webinars coorganizado entre ANFEM y GIS y BMJ. Hemos contado y hoy también estará con nosotros. Hemos contado con especialistas de BMJ, quienes trabajan directamente con medicina basada en evidencia y algunas de las iniciativas de BMJ para el avance de la práctica médica utilizando medicina basada en evidencia. Hemos también tenido el gusto de colaborar con el doctor Ramón, quien es sin duda un especialista en el tema que es referente para nosotros. Em, y esta mañana contamos con el doctor, nuevamente con el doctor Kiran Walsh, eh, quien es director clínico en BMJ, en BMJ Group. Se especializa en educación médica, apoyo a la toma de decisiones clínicas y métodos de evaluación eficaces que empoderan a los profesores de la salud y a los profesionales de la salud en general. También es profesor adjunto de docencia e investigación en la Universidad de Monash. Ha publicado más de 200 artículos en literatura biomédica y ha escrito 4 libros sobre educación médica. Así que es un gusto poder contar hoy con el doctor Kiran y sin más preámbulos le vamos a dar eh, la palabra al doctor Kiran para que comience el webinar. O Ramón, no sé si quieres hacer algunos comentarios adicionales antes de darle la palabra al doctor.
Pues nada más agradecer a Grupo GIS y a BMJ Group por esta participación y por esta colaboración con ANFEM. Estamos muy contentos. Hoy es la última sesión de este webinar, de esta serie, pero no estén tristes porque esto se va a transformar en un curso autogestivo para que todas y todas puedan vivir una experiencia extendida de este mismo curso. Muy agradecidos con el doctor Kiren Walsh de BMJ Group por su brillante participación. Estamos muy contentos con lo que nos comparte. Muchas gracias y bueno, adelante, vamos a disfrutar.
Gracias, doctor Ramón. Doctor Kiran, please.
Thank you very much indeed for your kind words and your welcome. Please bear with me for a second just while I share my screen.
Of course.
Thank you. So now sharing my screen, and you should be able to see a slide that says how to do research and get published. So I should start off by saying thank you very much to everybody for joining and thank you very much, Ramon and Eva, for your introduction. We're delighted to give this series of webinars and to develop a partnership with yourselves. This is the fourth in a series of webinars which have covered BMJ best practice, BMJ best practice comorbidities, evidence-based medicine challenges and barriers, and the fourth and final one, how to do research and how to get published. All these webinars are being recorded and will be made available after the event. So, what's on the agenda for today? I'm going to talk briefly on general principles on getting your research paper published in a high impact, high citation journal. I'm going to go into some details about how to write the introductions, methods, results, discussion, etc. And I'm going to end with some general principles on medical writing and getting published as well. So now we're going to get straight in. But as a first slide, I just thought I'd talk very briefly on why get published in the first place. There are lots of potential reasons. They're all written here. I'm happy to share these slides. If anybody wants to, please email me, and I'm happy to share these slides after the event, and actually also to share papers that are cited within the slides. But there's lots of reasons to get published, and I just want to point out two on this list. Number one, changing practice. Number two, education. The major medical journals are really most interested in papers that will help to educate their readers or to change or improve the practice of their readers as well. So think about those two things as a priority. And what do editors want? Well, editors want lots of different things. They want work that's important, that's honest and truthful. They want original work that's relevant to their audience. Of course, they want clear writing and they want work that has the real potential to improve decision making and to change practice. People talk about the wow factor every now and then. Can you produce a paper that will change the world, that will be really, really important? And I always say, don't worry so much about the wow factor. Try and get the basics right. The wow factor may come along, but try and get the basics right. And it's difficult to do all these things, to have work that's original, important, rigorous, and all these other things as well. How are you going to do that? Well, it's hard to be completely original, but think about how your work may be original in your setting, in your country, or maybe with your particular group of patients or particular group of healthcare professionals. The work will be original in some way. Don't worry about being completely original. Of course, it needs to be important and it needs to be academically rigorous and solid, and we'll go into a lot of details about that in a few minutes. Ideally, editors want work that's topical because they're like newspapers. During the COVID pandemic, work related to COVID was fast-tracked on to peer review. No guarantee of publication, but it was still fast-tracked if it met the bar for publication. Editors also want work that's international, so it may be of interest to you in your institution or your region. But the big international, high impact medical journals, they want work that's international. It's relevant in lots of different countries. And lastly, the big journals are usually generalist journals, the BMJ, New England Journal, etc. And they want work that's relevant to generalists, to general physicians, family physicians, public health doctors. But one thing that's even more important than all these different things is a saying that a writer writes. So you may do great work and do great research and have great ideas, but you need to write them down and you need to submit them to a journal to get published. And that may seem obvious, but I talk to lots of people who've done great things, and I say you should submit it to a journal, and only a minority do. And why don't they? The answer is that sometimes they don't plan things well enough, and you should plan from the start. And I say to people to write up your article before you even start and add in the results as you go. Now, how can you possibly do that? Well, if you're doing, say, a research project, you'll need a plan or a protocol, and it'll need to be written down. And the protocol will have an introduction and a methodology. And if you do a really good job on the introduction and the methodology, when you write your final paper, you'll just be rewriting those a tiny amount. So you're already halfway there. And even the results, you can start to write up the results, but just get ready to slot in the actual numbers at the end. Because the methodology shouldn't change part of the way through your project. If it does change, then there's a problem. And general advice, read the journal, read instructions for authors, read them very carefully. If there's anything not clear, ask the office. Many of the major medical journals have a rapid reject zone, which means that if you don't follow the instructions for authors, your paper won't be published. It won't even be seen by the editor. So if the journal expects Harvard references and you use Vancouver, it'll be rejected. If the journal says they accept editorials which are 800 words long and you submit an editorial that's 2,000 words long, it'll be rejected, etc. So it's vital to read the instructions for authors. They're always available on all journal websites. And these general rules and principles that I'm talking about, they apply to any type of study or any type of paper. It doesn't have to be research. The principles remain the same. We want to create a good first impression on an editor when you're submitting your paper. So it's worthwhile asking yourself, well, what's the first thing an editor might look at? What's the second thing? And what's the third thing? Etc., etc. And the answer to this question is very straightforward. This is what the editor will look at. First of all, the title, the cover letter, the abstract, and then they'll go on to read the entire paper. So to create a good first impression on the editor, you should think hard about the title, the cover letter, and the abstract. So let's go through them one by one. There's different types of titles. You can see them here. Look at the instructions for authors. Look at other articles in the journal. See the style of title that they have. There may be a word count limit on title. Sometimes they might say, if it's a randomized control trial, you need to state that in the title. If it's a case report, you need to state that in the title, etc., etc. So different journals have different styles, and some journals encourage a engaging style, like this one, Have You Ever Met analysis you didn't like, but others are more serious. So just check the journal. And then you need to write the cover letter. What should you put in the cover letter? Well, those things that I was saying earlier, put them in the cover letter. This work is original for whatever reason. It's the first time it's been done in whatever country. It's important and academically rigorous. It's topical because it's related to influenza and it's November. It's relevant not just in our own country, but lots of different countries. And it's relevant to the readership of your journal for these reasons. So spend a little bit of time on it. Don't leave the section blank. Don't say, please find attached. Don't ask, would you be interested in, or would you like to see a first draft? Because editors don't have time to read a first draft. They want to read the full and finished paper. And so what I'm saying is to sell your paper a little bit, just a little bit in the cover letter. Don't overdo it. Just state why it's relevant to the journal. And then you get on to the abstract. The abstract will be short, usually structured. The 80-20 principle states that sometimes 80% of our results come from 20% of our efforts. So all you really need to do is make a small extra effort on the abstract. It could really transform things. Another reason why this is important is because often the abstract is the only part of the paper that's freely available on Medline or PubMed, and so it needs to be high quality and it needs to be compatible with the full paper. Also, editors may screen papers by reading only the abstract. And what that means is that if the editor likes your title and your abstract and the cover letter, they read on. and read the whole paper. But if they don't like the title or think the abstract is poor quality and you haven't really tried with the cover letter, they might say, this paper isn't for the journal, and they might stop reading there. So you might spend hours working on the discussion. It might not be read. You need to make a good first impression. Often abstracts today need to be structured, but once again, it's a matter of following the instructions for authors. There's lots of resources that are available to help. Here's one resource from BMJ Research to Publication. But there's other resources as well. This is a website from the International Committee of Medical Journal Editors. Everything on it is freely available everywhere in the world. It's a rich resource. Now it's time to get on with your main paper, to write your main paper. And you're going to follow usually the IMRAD structure, introductions, methods, results, discussion. So let's get on with the introduction. Keep the introduction fairly short. Write 3 to 4 paragraphs on what's known and what's not known on the research question. There's no need to write a systematic review at this stage. Don't write too much. Just keep it short. And then in the last paragraph of the introduction, state or restate clearly what the research question is and state why this question matters, why it's important, why you've done the research. And then you've done the introduction. It's fairly straightforward. And then you need to get on to the methodology. The methodology is very, very important for informed readers and for peer reviewers as well. The peer reviewers will read this in really great detail. So you need to follow reporting guidelines, such as concert criteria for randomized controlled trials. You need to state that you've conducted the research ethically. You need to give information about statistical methods used. And ideally, see if you can format the methodology in the PICO format. So in this patient or population group, we tested intervention A against comparison B, and we looked at the following outcomes: morbidity or mortality or whatever. When you use that structure, the editor will think, okay, this person is using a structure that I'm familiar with. So that's good. I feel comfortable. I'll read on. This is it, PICO. A common question that I get asked is, what type of paper should I write? What type of study should I do? What type of paper will editors want to publish? And there is an answer to that question. The answer is that editors expect the study design to be the best for answering the particular research question. So if is drug A better than drug B, it needs to be a double-blind randomized controlled trial. If it's what is happening, it needs to be a descriptive study. If it's a question of can it work, it might need to be an analytic experimental study, etc., etc. If it's why doctors are behaving where they are, it'll probably be a qualitative study. But you need to justify that in the methodology. You need to explain in the methodology that the best type of research method for answering this research question is as follows, and that's why we chose it. I mentioned these reporting guidelines. They're all freely available on the Equator Network. Many of them you'll be familiar with, like concert criteria for randomized controlled trials. But actually, there are over 500 reporting guidelines, all freely available on the Equator Network. So no matter what type of research that you're doing, there will be a relevant reporting guideline follow it, and look at it beforehand. Look at it before you start your research, because then you'll be in a much better position to be able to write up your research when you're finished. There are translated versions of many reporting guidelines available. Often they contain a checklist. And I promise you, in the future, when people submit papers to journals, they'll be asked to submit a checklist along with their full paper, demonstrating that they're compliant with the reporting guideline. And that's really most important. There's lots of other free resources available to help with statistics. For example, here's a freely available paper from Doug Altman. You need, in the methodology, to say how and why the research is ethical. So you got consent, you deviated minimally from current normal practice, you imposed minimal burden on participants, you thought about risks and benefits, and thought about how society might benefit in the future. You respected data protection. You kept data confidentiality and patient confidentiality. And also, if it's research, you need research ethics approval. Why do all these things? To ensure that you don't get a placebo response. And you need to have all these things in the methodology, in the protocol, before you start. Then we move on to results. What should you put in the results? Well, you should report the results fully and honestly. You should use text to tell a story, tables to show the evidence, figures to demonstrate some highlights, and all those different formats should complement each other. Report primary outcomes first. Leave secondary outcomes to the end, and think about whether you want to look at the secondary outcomes at all or report on them at all, because primary outcomes are most important. Report essential summary stats like confidence intervals, and importantly, don't start to interpret the results here. Don't start the discussion yet. Stick to the facts. Outline what the results were. You can discuss them in a minute when we get to the discussion section. And as I say, use graphs or figures if you can, if they add value. Here's a cartoon that was published in the BMJ a few years ago. Do report harms. It's a problem in medical research that harms are underreported, and often preventable harms are underreported as well. So if you do report harms, the editor will be impressed, if nothing else. And we realize that doing research is complicated. I've done research myself. And sometimes you might start off, plan to do research in a certain way, but for some reason, maybe you didn't recruit as many people as you wanted to. No plan survives first contact with implementation. So you need to be open and honest and truthful. Editors know that no research is perfect, but they do expect researchers to report their work openly and honestly and fully. Then we get on to the discussion. So in the discussion, don't simply repeat the introduction. Maybe give one sentence on background, but state or restate the principal findings. Point out the strengths and weaknesses of the study. Inevitably, there will be some. And point them out before the editor realizes them or before the peer reviewers realize them. And point out the strengths and weaknesses in relation to other studies, especially systematic reviews, and key differences. The reason is because no study is an island, just as no man or no person is an island. You have to interpret studies in the context of the wider research, research picture. And if you can say, well, my study was small, but it adds an important piece of the jigsaw to the wider research landscape, the editors will be impressed because you've filled a gap. The last three things on this slide: mechanisms and explanations, implications, questions. Go easy on those things. Don't write too much. The reason is because we're not too sure often what the explanations might be. Usually there's a bit of guesswork there. In terms of implications, it would be wonderful if our research was used in guidelines internationally, but that doesn't always happen, and often it takes lots of research projects and meta-analysis for it to be cited in guidelines. Don't end with further research is needed. If you think further research is needed, state exactly what research is needed and how you did that, or how people should do that research, what methodology they should use. You need to state any funding that you received, be open and transparent about that. If there are competing interests that you or your co-authors have, you need to be transparent about them and state the competing interests. This is a copy of the BMJ from about 20 years ago now, on the problem of competing interest in research. And often people ask me, well, is this a competing interest or is it not a competing interest? Should I report it? And I always say, just be transparent. Don't worry about whether it is or it isn't. Just state it, and then the editor will decide how important it may be. A common question, and I'm back to general principles now. A common question we get asked is, who is an author? Who should be an author on a paper? And the ICMJE recommends that authorship should be based on the following criteria. I won't read all this slide out, but a key word in this slide is and. So you need to do all those things if you're going to be an author. If you just advised on people to start the work, that's not enough. You need to start and help carry it through and help write it up as well. You need to satisfy all those criteria. So how are you going to do that? Well, set up an authorship working group, decide who are going to be authors, and determine and decide what contributions count as substantial, track progress towards substantial contributions, and chase your co-authors up. Make sure they do contribute. There's another free resource that's available called the COPE website, the Committee on Publication Ethics. It's all freely available. Everything on this website. There's lots of very helpful resources and examples and guidelines there. Some advice about writing. Use simple words where you can. Use short sentences where you can. Use active voice. Try and make your research paper readable. Try and avoid cliches such as these. I won't read them out. Rudyard Kipling came up with this famous quote. When he's telling a story, he asks himself and tries to tell the readers the answers to the questions what, why, when, how, where, who. So see if your paper can tell a story so that people will quickly realize what you did, why you did it, when and where you did it, how you did it, and who you did it with, so that the paper will be readable. So try and write like the sentence at the bottom, not like the sentence at the top. Unfortunately, lots of the medical literature is like the sentence at the top. It shouldn't be. It should be like the sentence at the bottom, so it's accessible. Drummond Rennie was a famous North American medical editor, and he came up with this quote. And I'll share the slides. I want to leave lots of time for questions at the end. Um, but I think this quote is important because it shows what happens when you don't do medical research properly and you don't write it up properly. So even though I'm saying to write simply and clearly, also write in a scientific way. So don't say a disease is common, state the incidence and prevalence. Don't say that a test result is reliable. Describe it in scientific terms. State what the false positive or false negative rates might be. Don't say a treatment is good or bad. State what the level of evidence is. Absolute risk reduction, number needed to treat. And then you've written your paper. Before you submit it, read it yourself carefully. Check it with your co-authors, some expert colleagues in your department, and maybe some non-expert colleagues as well, so they can point out problems, errors in the paper before the editor does, before the peer reviewers do. Think about the journal, even though I think this slide maybe is out of place, because I generally advise people think about your ideal target journal before you start. Where ideally would you like to get this paper published? Sometimes people present their work as posters or as platform presentations. Do they count? Yes, they do, particularly when you're early in your research career. Because when you're early in your career, everything counts. Then it's time to submit. Give yourself some time. It will take a couple of hours with most journal websites. Get everyone's details beforehand. Electronic submission is hard the first time, but the system will remember your details and it will be easier in subsequent occasions. After you submit, you need to wait. There's no point expecting editors to get back to you the same week. It'll take a little bit of time, so you need to be patient because the the admin person has to look at the paper, send it to the editor, who reads it, who finds peer reviewers, sends it to peer reviewers. The peer reviewers need some time to look at it, to get back to you, etc., etc. It just takes time. If you haven't heard after a few months, you can inquire or you can just check the manuscript submission system and see where your paper is. And then you'll get a decision. And the decision may be yes, we'll publish if you can make these small changes. And if you can make them, great. But be quick. Do it quickly. The editors can't wait forever. The answer may be maybe. Uh, Can you make these substantial changes? See if you can make them, but don't wait for months and months and months. See if you can make them fairly quickly within a few weeks. And the answer may be no. And for some journals, there may be a possibility of appeal. There's different types of peer reviewer: open, where everybody knows who everybody else is; single, where the peer reviewer knows who you are, but you don't know who they are; or can be double blind. One important point is that the peer reviewer advises, but the editor decides. So don't be downhearted if you get one negative peer review. The editor will take an overall view. I always say volunteer to become a peer reviewer. You'll learn from the experience. You'll see things from the other side. So once you have a little bit of experience, do you volunteer to become a peer reviewer? It's hard to get published in the top high-impact medical journals. For research papers, they have acceptance rates of about 5%. So it's hard. Here is a cartoonist on the peer reviewer process. This is a few years ago now. I'm sure things have changed since then. So even though the high impact journals, it's hard to get published in, some of the open access journals, a little bit easier. What if you are rejected? What if your paper is not accepted? What should you do? This is important because not all papers will be accepted first time. So tell your co-authors, look at all the feedback, use the feedback to improve the paper. Do this in line with the requirements of the next journal. Otherwise, some revisions may not be relevant. And you can, if you want to, in the cover letter to the next journal, state that it has been peer reviewed by the previous journal. There may be an opportunity to appeal. When should you appeal? Well, I think if the editor was negative and all three peer reviewers were negative, there's probably no point in appealing. But if one or two of the peer reviewers were positive and one was negative and not everybody agreed, and you can see it was a borderline decision, it may be worth appealing. This is maybe one of my most important slides, and it's one of the last few slides. And it's don't give up, essentially. I've been lucky to have lots of papers published and a few books published as well. But I always say to people, you don't see how many papers I've had rejected. You don't see how much work I had to do to please the peer reviewer. You don't see that that paper, which is published in this journal, actually I had to submit it to two other journals beforehand from which it was rejected. So keep going. You might have to go down the impact factor by a few points, but don't worry about that. Papers will find their level. Do keep going. Will get accepted in the end. And here's our values at BMJ. The values that are important to this talk are independence. So you may get funding for your work, for your research, but the funders shouldn't influence the outcomes. You should be transparent and open about competing interests that you have, financial or otherwise. You should try and produce work that's to the highest possible evidence-based standard. And of course, you should be thinking about patients all the time and sometimes involve patients in your research as well. Get them to advise you. I'm glad to say that this is just one talk, but sometimes institutions come back to us and say, oh, could you give us a talk to our residents on how to get a case report published or how to get a meta-analysis published, etc., etc. And we can do that if need be. One of the problems, I think, in research and how we do research is giving very big, ambitious projects to people starting off. Whereas, in fact, with people starting off, I think we should give them smaller, simpler projects like writing up a QI report, writing up a case report, just so they can develop their research and academic and writing skills on small projects first of all. This is the last slide. I'll leave it up here for a second as my email address is there. So if people want to screen grab and to email me after this event, I'm very happy to be contacted and let me know if you want the slides. This is BMA House in central London, where our office is based. And if ever you're in London, do let us know. We'd be delighted to have you as our guest at BMA House in the future. So please bear with me. Now I'm going to stop sharing my screen. And I think we've got about 10 or 15 minutes left for questions and answers. If you do have questions, please put them into the chat or into the Q&A if you wish. Um, so I'll just wait a minute to see if anybody has any questions.
Let me ask, Xavier, ¿ves algunas de las preguntas? ¿Hay alguna pregunta escrita?
Hola, no, parece que no.
Ok, perfecto.
So sometimes people are shy and don't want to be the first person to ask a question. So when I ask myself a question, this is the most common question that I get asked, which is, what if I disagree with a peer reviewer? What if the peer reviewer suggests something and I think the peer reviewer is wrong? What should I do? And I'll tell you how I tackled that dilemma. And it's to go through all the peer reviewer comments. Maybe there are 10 comments. Concentrate on the ones that you agree with, first of all, and whereby you can change or improve the paper, and answer those and improve the paper if you can, and state how you've done so. And then when you get to comment number 9, maybe you'll disagree with that. State why you disagree with it and why you're not going to change the paper. And comment number 10, why you disagree with it, why you're not going to change it, etc., etc. And you can rearrange the comments. Just because you received the comments in a particular order doesn't mean that you necessarily have to answer them in that order. And editors in chief are human beings like everybody else, and they will look at the comments and look at your answers, and they'll think, my goodness, this person has tried really hard and has answered 8 out of 10 of the questions really, really well. Okay, come on. Let's see if we can accept this paper.
Oh, thank you very much. And I like this practice that we can hear some of your most common questions. Is there any other one that you usually get after your presentations?
Yeah, sure. Like I would say that people will commonly ask, well, what type of research paper should I write? And what type of research should I do? And what type of research paper will editors in chief of major medical journals be most interested in? And the answer to that question is that ultimately editors will look at a paper and look at your methodology and see was your paper the best type for answering that particular research question, number one. They'll also look at how important the paper is, how topical it is, and how original it is, even though we know it's very hard to be completely original. And even great researcher, not from medicine, Isaac Newton, he said the only reason he's been able to achieve those things because he was standing on the shoulders of giants, because he was able to see it that far because of all the people who came before him. So he was building on other work. I would say another tip is that often with junior researchers, resident doctors who are starting off and they're doing their research projects, they're given very difficult tasks, like write a 10,000 word meta analysis in the next 6 months. That's very hard for anybody to do. So I'm not a surgeon, but say if I wanted to go back to medical school and train to be a surgeon rather than a geriatrician, would it be a good idea for my first operation to be an abdominal aortic aneurysm? Or maybe I should start off with an ingrowing toenail or stitching up a patient. So in clinical medicine, we teach people by getting to do simple, straightforward tasks at the start. The same should be true in evidence-based medicine and research. We should get people to write up short, simple case reports, 800 words. You can do that in a few months. Quality improvement reports, 1,500 words. You can do that in less than a year. And they'll find out, do they enjoy it? Do they like it? Are they good at it? You'll find out about them as well. And then for project number two, then you give them more ambitious projects.
Oh, that's very good. Thank you very much. And we shared before our intention with this collaboration with MFEM is to stimulate the young students and not only doctors or researchers who are already in the path of publishing, but also that community of future doctors that might be starting to get related to research. Is there any additional recommendation you can give us? Maybe your final recommendation to stimulate this community to go and try to publish in international journals?
Yes, there is. So I would also say to people even though they're ambitious, which is a good thing, don't rush in and plan it a little bit before you start. So sometimes people come to me and they say, I have a paper, where should I submit it? And I know them, I'm friends with them or their boss, and I ask them about their paper. And it might be a simple paper like a survey. And I ask them questions about it, simple questions like, did you validate your survey? Did you pre-test your survey before you started? And they didn't. And that's
Mm.
not good news. They're going to struggle to get that paper published now. So, what I would like is to invent a time machine and to go back in time about a year and to have that conversation with them before they started. So, I'd be able to say, you need to validate your survey, you need to pre test your survey. Now, we don't have a time machine, but we do have the Equator Network website. And so that if you plan to do a survey, you can go to the Equator Network and find a reporting guideline for surveys. And you can find a reporting guidelines for case reports, for quality improvement reports, for qualitative research, for randomized control trials, for meta-analysis. I could go on for the next hour, but I'm going to stop. There's no shortage of them. But you need to look at those and see, okay, when I'm writing up that paper, I'll need to have a line in there stating that I pre-tested the survey, so therefore I need to do it. And then you'll do it. And then ultimately in 6 months' time, you'll have a paper that you're much, much more likely to get published. So I think it partly comes down to close supervision by the senior researchers, um, but also planning your paper properly before you start your research, so that you'll end up with a good, high quality research project and high quality output at the end.
Oh, that's great. And also, I will um, stress on that on going to these resources that are open, right, to all of us to learn from and to use them, right, as a good guide.
Yes,
Um,
yeah. Like another problem I see is that with some young researchers, and some of these are from major London teaching hospitals, and they say, I have a paper. And I say, what type of paper is it? And they struggle to answer that question, which is a red flag. That worries me. And often because they should know the type of paper they're written. And often they tell me then, well, my boss gave me a database and said, do something with that. And that's bad practice because that means you're essentially going on a fishing expedition. You're going fishing and you don't know quite what you're going to find, but you're going to put your line into this database until you find something interesting. And that's bad practice. You should plan at the start. You should have a hypothesis at the start that you're going to prove or disprove as a result of your research. If you just try and find patterns in a database, then if you assume 95% confidence intervals, 5% of the time you're going to be wrong. So all you need to do is just, if you want to practice bad science, which nobody does, but that people don't realize, it's just look for a pattern 20 times in a database, you'll find something, but it won't be valid. So I think once again, it comes down to planning beforehand and don't have this approach whereby you don't use the scientific method.
Noted, and very, very relevant. Those reminders, right? Sometimes we're so focused on when we want to do the big picture, but those are very, very important reminders. And yes, I thank you so much, Dr. Kieran. I'll use these minutes to invite all our attendees to the next session, right? And of course, now you have Dr. Kieran email, and we'll share also this presentation. So thank you very much, Kieran. And I'll change to Spanish now. Muchas gracias a todos los que han asistido a esta presentación. Gracias, Leticia, por su comentario. Para nosotros es un gusto, como mencionaba al principio, poder colaborar, como mencionó también el doctor Kieran. Por favor, siéntanse invitados a las páginas web de BMJ, donde van a encontrar recursos que son gratuitos para que sean alguna guía para el comienzo de este proceso de investigación. Para nosotros es un gusto también poder invitarlos al resto de sesiones que tendrán en las siguientes semanas en ANFEM con especialistas mexicanos que van a hablar sobre medicina basada en evidencia. Este será probablemente el cierre de nuestro ciclo con BMJ. Pero pues vamos a seguir a la orden en comunicación y nuevamente no puedo dejar de enfatizar que es importante, hay recursos abiertos que están disponibles en las páginas de BMJ para ayudar a estos procesos, un poco de guía, que nuestra intención, mencionábamos antes, es poder tener más autores latinoamericanos publicando en revistas internacionales en el área de ciencias de la salud. Ah, bueno, muchas gracias, Anfe, muchas gracias, Xavi.